You know what? If that story put a smile on your dial, you know what else would put a smile on your dial? Going to the dentist and hearing, your teeth are healthy, nothing needed here today, go on off with you.
Yeah, they'll still charge you a lot though.
Mozza.
Sorry about that. But, you know, your dentist might not just be talking about your teeth. It seems a visit to the local fang doctor can help identify numerous medical conditions that may be affecting your day-to-day health. So joining us to explain the added benefits of regular checkups is our dentist guru, Dr. Luke Cronin.
Hey,
hello.
guru.
Hi guys, thanks for having me.
So it's not just the mouth, it seems. I mean, a regular visit can reveal so much more, such as...
So when we're actually looking at the general health, and we
Yeah.
can see that by looking at things such as teeth grinding, we can look at decay, and we can look at gum disease.
Okay.
If we're talking things like sore teeth, sore jaws, and we're talking teeth grinding, what would that look like? What are we doing at night?
So everybody grinds to a degree at night time. So we often do really strange things in our sleep that you wouldn't think of doing when you're awake.
Is it just that you don't like the person you're next to and you just, oh...
Well, it's more to do with some underlying issues and things like, you know, having sleep disturbances from stress. And we show that with our grinding, and we can see that as a dentist with the teeth being worn down.
Yeah, okay.
Is that a massive issue? Is that going to be problematic, or is that just a wear and tear factor?
It's becoming one of the bigger issues. As society gets less decay, we're getting more stress and we're getting more wear. So it's one of the things that I think we're going to see as a bigger problem moving forward.
Interesting. I mean, a chiro or a physio might look at you walking, can understand what's going on with your spine and your muscles, etc. You get a good gauge of someone's health by looking in their mouth. What about decay? We always cover that, don't we? We think it's, oh, I've just had too many lollies. Does that tell us something about our health?
Well, decay is caused by excess sugar. And excess sugar, in the long run, can actually lead to diabetes. So if we're seeing decay in people's mouths, there's a good indicator moving forward in the future that they could likely end up with diabetes.
Wow, that's so interesting.
Yeah,
what about something like gum disease? I know we've spoken to you before about bad breath. Gum disease, gum health, I mean, I guess it can sometimes be overlooked because we're just focusing on the brushing of the teeth and not the gum health. How vital is it?
Well, gum health can lead to heart disease as a problem. So having poor gum health and periodontal disease really increases that chance. And I think that especially if we've already got either issues with our heart or diabetes, it's really important that our gum health is completely up to scratch, and doing that every 6 months with the dentist.
So kind of flipping that around, if you take really good care of your teeth and brush a couple of times a day and floss and do all that, it might mask if you've got actual other issues. At least you're presenting with a healthy mouth.
Well, that's one of the things that when you do go to the dentist, we can diagnose those issues, and we can work out what may be going on systemically as well.
Okay, interesting stuff. Thanks, Dr. Luke.